A bit about pain management. As you've heard by now, knee replacement surgery can be a bit of a tough recovery. That said, advances in pain management protocols have been made that have significantly helped. The first day or two is typically not too bad while the regional nerve block is working. During surgery, Dr. Laux also injects a cocktail of 5 different pain medications around the incision that's going to usually last about 2 to 3 days. This usually eases the transition of that nerve block wearing off, which is typically around 24 to 36 hours after surgery. We recommend taking over-the-counter Tylenol and alternating with ibuprofen if you're able. Frequent ice and elevation of the leg is a fabulous way to help control pain without narcotics. You will also be given a prescription for stronger pain medication. Typically, it's a narcotic called oxycodone for what we call breakthrough pain. In the current opioid setting, we aren't often able to prescribe any more than a week's worth of these medications at a time. Additionally, muscle relaxers can often be helpful as well for some thigh spasms, as well as any nighttime discomfort and restlessness that you may have. Typically, the first 4 to 6 weeks is where you're going to feel the most pain, stiffness, and swelling. And you may be asking yourself why in the world you did this. It is not uncommon for patients to have trouble finding a comfortable position to sleep following knee replacement as well. Muscle relaxers can help with this. At the end of this time period, you will start to see some light at the end of the proverbial tunnel, and you'll be reminded why you did make this choice, and you can start to look forward to the fruits of your labor. The bulk of the recovery is about 2 to 3 months, but it's normal to have some level of soreness, stiffness, and swelling even up to 1 year after surgery. We highly recommend you apply ice and compression during the initial phase of your recovery. You may use ice packs, gel packs, or sometimes even a simple bag of frozen peas gets the job done. We do offer a cooling and compression device that we can provide for you. You can refer to Dr. Lauch's separate video regarding this device for more instruction. Cooling and compression are 2 huge keys to a better recovery. You will likely want a walker, possibly crutches, or maybe even a cane to assist as well when you first get up to walk. You can use these devices anywhere from 2 days up to 2 weeks. It really just all depends on you and your comfort level when you're getting up to walk. If you feel unstable, we definitely recommend the use of a walker. Once you feel like you can get up to walk independently without it and do so safely, you can forgo the assistive device. We will have you on a blood thinning medication after surgery because you are at risk for blood clots, or what we call deep venous thrombosis, or DVT. The highest part of this risk is about 4 to 6 weeks after surgery. We're going to risk stratify you and determine which medication is best and suits your individual needs. We also recommend you wear compression socks, use sequential compression devices that intermittently squeeze the calf to promote the blood flow, as well as doing active ankle pumps. We want you doing all of these things for about 3 weeks to keep the blood flowing. Home sequential compression devices are in fact part of the cooling and compression kit that's referred to in additional videos with Dr. Laux. All of these things will go a long way in preventing blood clots. Remember, prevention is key. Many patients definitely want to know about resumption of activity after their knee replacement. In the early phase of your recovery, we recommend you get up at least once an hour in the initial day or 2 after surgery. Take a 5-minute walk or so around the house. Go to your bedroom, bathroom, kitchen. We encourage short, frequent walks, and as you feel more comfortable and stable on your feet, you can go out and do more as you tolerate. In the week after surgery, you can walk around the block or even walk to the mailbox. If you do too much, your body will tell you. You will notice increased pain and swelling to your knee and leg. If this happens, you should rest, elevate the leg, apply ice, and take it easy. We definitely recommend physical therapy after knee replacement surgery. This is going to help restore your range of motion as well as strength. The ultimate goal for your range of motion is full extension, which is 0 degrees flat and at least 120 degrees of bend, though many of our patients actually do get upwards of 125 or even 130 degrees. You should receive a call from the physical therapy clinic scheduling you for a pre-op assessment, as well as to schedule your regular post-op visits. We want you to start after surgery about 5 to 7 days after. If you recall in Dr. Lauch's other video, We definitely don't want you going too much, too soon, too fast. Slow and steady will win the race here.